We know they're doing fecal transplants out there now for a variety of GI disorders.
Absolutely.
But now people are actually advocating this in the treatment of autism. So is that really going on?
Yeah. Sure. So it is going on, but the jury is really still out on fecal transplant. There's essentially been one study published thus far. It was a small study, and it was in children with autism. They were given fecal transplant for about 2 months and followed for a few weeks after. And the results were very exciting. You know, they had great outcomes, both behaviorally and also in their gastrointestinal issues. And even more interestingly, they followed up on these kids 2 years later, and these kids still had improvements in their behavioral profiles as well as their gastrointestinal symptoms.
That's pretty impressive. That's impressive. So are there more ongoing studies?
Sure, there's several double-blind placebo-controlled trials going on now. So I'd say we should wait for the results of those. Sure. Because I'd just like to point out, for families who are considering this outside of a medical office, that while we have a lot of amazing bacteria in our guts, we also have bacteria that's potentially harmful. And there's been studies that say, for example, when you take stool from a patient with Parkinson's disease and you put it in certain mouse models, those mice develop symptoms of Parkinson's disease. Similar studies have been done in depression. And so you really want to be careful what you're putting into your gut. And we want to make sure that these fecal transplants are not only effective, but effective in positive ways.
Wow, those studies, so interesting.
That is.
Who would have thought? I mean, this gut central nervous system connection
is real.
It's real.
And more important and more involved than we previously thought, sounds like. Yeah. I mean, gut health is so important, and nutrition is so important. So Dr. Margolis, for those parents out there who are just struggling, trying to figure out something to do, what do you recommend for them to optimize their autistic child's nutrition?
Don't eat a lot of processed foods. Don't eat the preservatives that accompany those foods. Don't eat a lot of artificial sweeteners, and have a lot of fiber. So in preclinical and clinical studies, fiber has been shown to be anti-inflammatory and have positive effects on mood, while preservatives and artificial sweeteners have shown the opposite. So as much as you can avoid those, I would recommend that. The other thing I just wanted to point out is that a number of people with autism are on specific food diets. One of the more common is the gluten-free diet. So you really want to be careful when you're trying those diets to make sure that you're still nutritionally replete. So I'd say that if you're going to try a diet like that, make sure to do it in concert with a nutritionist or somebody else in the medical field who can help you to make sure of that. So I think the summation of that is be safe, eat nutritionally, and let us physicians and scientists do the rest. We'll figure it out for you.
Yeah. Make sure you run it by your
100%.
Your doctor first.
100%.
Absolutely. Okay to try, just do it safely.
Right.
Great information,
Great
Dr.
information.
Margolis. Thanks for stopping by today.
Thank you for having me.
Thank you.
All right. Hope to have you back.